एक मिनट। ये क्या कहते हैं? आपने ना बहुत ज्यादा ऊपर इजी होकर रहे हैं, कुर्सी के ऊपर बहुत ज्यादा ना होने के चलिए।
Hello, this is Dr. Mursaleen from Pakistan, and I'm the CEO of Pak One Health Alliance. And this is really a wonderful day and wonderful occasion for me, an honor for our organization to give this update and briefing on the operationalization on implementation of One Health event-based service activities in Pakistan. This project has initially been supported by ending pandemics, and we have the local partnership. But I will try to give you a little briefing on Pak One Health, its work.
ये बीच में से बीच
ये तो थोड़ा बहुत आगे है ना, इतना तो है ना।
यही चीज होती है सर। वो कहते हैं उसको देखा है, वो बंदे साथ होते हैं
मुझे सेट करके
यस करके झंडे, वो दो झंडे देखे आपने जो लगे होते हैं
उसके बीच में बैठ क्यों
मैं उसे में ना जरा
देख रहा हूँ, बिल्कुल रहना चाहिए कि
सीधे सीधे पूरी कर। नहीं ये क्यों रख रहा है यार? चलो दफ्तर छोड़, तुम लैपटॉप रख। वो नहीं तेरा खोले इसको। वो नहीं
फिर तो वही मैं रख लेता हूँ।
चलिए खोलिए एक मिनट फर्स्ट करने स्टॉप।
Very good morning. This is Dr. Mursaleen from Pakistan. I am the CEO of Pak One Health Alliance. It's a great privilege and honor for me to provide a briefing and an update on this innovative project called One Health event-based surveillance program in Pakistan, which has been supported by ending pandemics, and we are really grateful for their technical and financial support. And so my presentation would be little bit about Pak One Health Alliance, some of the activities, and certainly more I will be dilating on One Health event-based surveillance project. So Pak One Health Alliance is a local non-governmental organization which was established in 2014, and this is the main focus of this our work is you see the curtailment and prevention of all those diseases which are emerging through animal, human, vector, human, water, human, food, and human interfaces, interplay between the two. And you know that in this era of high population, specifically in our countries, it's very critical that there are several diseases which separate, which cross from one sector to other, from one area to other, and they implement it. So, so we actually, Pak One Health Alliance is working very closely with the government. We have partnership with the MOUs with the government, departments, ministries, academia, and other important related partners, including the international partners working in Pakistan. We have a secretarial and a coordination body and center of excellence. We have like a directory of experts from all these sectors. So the priority areas is certainly Pak One Health promotion, its education, emerging neglected diseases, one of the areas, virus safety and management, One Health surveillance, and you see the foodborne diseases, ending, you see the pandemics, COVID-19, recently we organized a nationwide readiness exercise on that, ecosystem, disease emerging, antimicrobial resistance. So there are several important areas of One Health where the work in other countries or other situations globally have been initiated. But these are the five main thematic areas: zoonotic diseases, antimicrobial AMR, vector-borne diseases, environmental contamination, and food safety. And luckily, we have been working in these all these areas and have done some projects on that. So there are multiple partners, both national and international, which have been working, which are working. And certainly once we start any work in the country, we have a very good connection and understanding and mutual agreement on the methodology, on the outputs, on the outcomes of certain, the projects and programs. So starting in 2014, we have accomplished a number of projects that related AMR, vector-borne diseases, virus management, biosafety, and the One Health promotion itself. The COVID-19 readiness, pandemic readiness exercise, and currently since 2021 and up to 2023, we are working on this project called One Health event-based surveillance. So event-based surveillance is a unique in itself. It is it's never been done before in the country, and because there have been indicator-based surveillance programs already been launched, but event-based surveillance program has never been initiated or never been thought after. So Pak One Health Alliance developed number of manuals during this part as in coordination with the government and other partners. These are related to virus management, the One Health curricula, short course, curricula for the district and operational managers, mapping exercise, EMR regional studies. So all these documents and manuals are available and have been also launched on our website. So these are the activities, the tropical neglect diseases workshop that we had in coordination with the international partner that was organized in Albania, and that study we did together with the GODS and other organizations. So coming to the One Health EBS project, the program, which is like a 2.5-year program. So this program is the main objective or goal of this is to create integrated One Health platform, you see. And so create conditions where the multiple One Health department sectors can work together, you see, and they come to close to each other rather than only having bookish or theoretical knowledge on One Health, actually translating what we have learned and be talking about One Health into action. So the main areas of work in this project is developing some appropriate ICT solutions, specifically smart collaboration across multiple sectors, especially dashboard and applications to train stakeholders on One Health event surveillance procedures and develop manuals and training material, create timeliness, create tools, manuals, and share experience from other countries. And thanks to ending pandemics and some other organizations that we had very close collaboration with the similar projects in other countries, especially Bangladesh and Albania. And we had very frequent interaction with them because they are undertaking similar projects and we need to learn from each other. So that was a good opportunity, and that was provided from the platform of ending pandemics. So we did a mapping exercise, national mapping exercise, a gap analysis exercise, which focused on 2 areas: mapping of One Health related department organization and snapshot of multiple MIS systems. Those are being run by specific One Health departments. So this was a dissemination workshop of One Health mapping exercise. And then these are the manuals that we developed. We developed 2 types of manuals. One manual, very like a 3 days, quick, very short training sessions program for busy district managers of livestock department and of health department and environment sectors, and also a manual, a training program for like 2 weeks training program, which has been organized in organizations or academia, universities, public health universities, livestock universities, and other, you see, the education departments. So these are the training workshops that we organized on One Health EBS, and one in Islamabad, one in Lahore. And now we have been working on very innovative areas of epidemic intelligence. The main components of epidemic intelligence is, you see, the area is the detection of public health event, this verification, risk assessment, risk communications. So these are the important steps to be, which are being followed. The important area, because there are indicator-based surveillance and then event-based surveillance systems. We have been working on indicator-based, but even was never been explored in Pakistan. And now recently we have been started working on it, and there have been trainings of staff on this subject. So these two systems are being combined at the platform of One Health dashboard, where the information from indicator-based regular MIS systems and the event-based surveillance this information coming from media, multimedia, from news, the news, from television, from multiple sources is tapped some way, and you see, and is collated on the dashboard. One Health dashboard has been developed for decision makers for joint action planning and monitoring. Implementation is being done in stages. So at this stage, we are focusing zoonotic diseases and starting with the health, animal health, and public health sectors. So this is the conceptual framework where the MIS of multiple sectors, information on priority information on disease is extracted to a common dashboard platform and then analyzed and disseminated to the decision makers. At this stage, there are like 8 regular indicator-based MIS systems in the public, and one is from the livestock sector. And this MIS system that is combined on the dashboard, and we have selected some priority diseases for this on which we are working. So this is one dashboard. Priority diseases. If you click on one disease, it will give you the information gathered from multiple MIS systems on one platform. So this is the geographical representation. So the challenges that we are now meeting once the project closing is capturing of the real-time data for disease of One Health surveillance system. Completion of this pilot project of dashboard. This has been piloted. It is yet to be rolled out. Setting the stage for evidence-based decision making, where the information from multiple sectors is collated and culture is created for taking actions. Development of SOP, and you see rollout of the SOPs or for intersectoral coordination and exploring partnerships, and support the One Health promotion, continued support for One Health promotion, local and implementation partner. So one of the important areas, now that the project is closing, is how to get it to a sustainable mode. You see, in this connection, there have already been agreed and agreements and notifications by the Ministry of Health and by the Institute of Health, Pakistan, and Livestock Department, that the work done so far would be adopted, scaled, and would be implemented now by the government itself. And Pak One Health Alliance will certainly still be working towards this end from its own platform. Thank you very much. लेंथी है सब
उसको स्टॉप करें और सेव कर लें मीटिंग एंड करना है एग्जिट नहीं करना
मैं कर दूं स्टॉप ना करूं
छोड़
इसी होते हैं इसी के ऊपर बहुत करने वाले
ये कितने मिनट का है?